Ready or not, here comes the Medicare for the Lazy Man podcast. The Medicare podcast suffering from seasonal affective disorder. He wonders what punch drunk really feels like. It's Medicare expert Doug Jones.
Hello, everyone. Thank you so much for joining us. This is Doug Jones. The Medicare for the Lazy Man podcast is the location, and big fun for all is the goal of our podcast episode today. I don't know if we'll achieve that, but the important thing is that you come away from this podcast episode with a more positive attitude about Medicare. So many people approach Medicare with trepidation, and they're concerned, and they're fearful, and they're confused, and they don't know what to do. And I can be your guide through the Medicare morass. And I like to do that through helping you understand what it is about Medicare that other people make confusing. So the way to do that is for you to read one of my books. I would suggest you read all three of them, but the important book to read is my flagship book that's on sale at Amazon.com, Medicare for the Lazy Man 2026 is the current edition. So if you go to Amazon.com, type into the search window Medicare for the Lazy Man 2026, you're going to find my book in several different formats. You're going to find it in a paperback format for $11. You're going to find it in Kindle format for about $5, I think, $6. You're going to find it in Audible format, which means you can listen to it. And that's about $6.50, I think. And then, of course, you're going to find the magnificently created hardcover version, which is a $25 item, but it is so durable and so timeless that it will last you forever. What does Medicare for the Lazy Man 2026 have that no other book has? Well, it has my current opinions, recommendations, observations, and ultimately my wrap-up of all of the Medicare knowledge that most people will need to know in order to get a big picture understanding of Medicare. Now, not everybody needs to know all this stuff. For instance, I've got a chapter devoted exclusively to the 3 states that have very weird Medicare supplement regulations. They don't follow the rest of the country. Those states are Wisconsin, Minnesota, and Massachusetts. Well, not everybody's going to need to read that chapter, so you can subtract a few pages right there. Now, if you want to know what goes on in these states, you can gain additional understanding by reading those chapters, and that chapter is not very long, but it's an example of the kind of thing that will allow you to get through the book very quickly. You don't need to read the chapters that don't really apply to your situation. The most important parts of the book are condensed right in the very beginning. For those who are approaching Medicare and need to know the quick, down and dirty message, everything is in, I think, the introduction, or if not the introduction, everything is in the first few pages in order to consolidate my recommendations in a very digestible manner. And then the rest of the book is elucidation, explanation, details, and things that are explanatory in nature. Now, let's suppose that you need to pick out a drug plan, and that's pretty much everybody with a Medicare plan needs a drug plan. If you're one of these people that's going against my recommendations, you're signing up for a Medicare Advantage plan, you're stuck with whatever drug plan that Medicare Advantage plan offers you. That's just it. No choice. That's what you get. Take it or leave it. Actually, you can't leave it. You have to take it. But if you're in following my recommendations, you're in Medicare with a Medicare supplement plan to fill out your protection under the health insurance program, then you have the option of picking from any one of the available Part D, as in Delta, prescription drug plans that are available in your area. And so there's a precise method for determining which one is going to be the best for you. And the best drug plan is always going to be the cheapest drug plan that covers all of your drugs at the pharmacy that you prefer to use. So what I have done is written a book called Medicare Drug Plans, a DIY guide. You can take that book and go to the government website on a computer. That's the most useful way to do it. And the book will show you screen by screen by screen, page by page by page, how to use the government website to identify the best drug plan for you and to enroll in that plan. It's a very quick process, but it's a government website, so it's not always designed to be user-friendly. My book will help lead you through that process. And you can have that for the princely sum of $10 in paperback, which is probably going to be the easiest to use. $3 if you want to use a Kindle, and I don't know what the Audible version is being priced at, but those are the ways to purchase Medicare Drug Plans, a DIY guide. And then finally, if you've decided to follow my directions, you don't want to know about anything else, you don't need to bother your pretty little head about any sort of Medicare knowledge, history, or interesting facts other than just enrolling. What do I do to get her done? Well, my book, Medicare Enrollment Guide, is just the tool for you. It's about 20 pages of instruction. It's got a few more pages of explanation that you don't really need. It's got about 20 pages of instruction. It will guide you right through the process from start to finish in short order. And that book is available to you on Amazon for just a few bucks. It'll be a $5 purchase if you like the paperback route, or if you want to purchase the Kindle version, it's about $3. That's the least they'll allow me to charge for a book. And if you want it for free, that's what I recommend. Go to MedicareForTheLazyMan.com. That is the website for all things Lazy Man for the Medicare. And scroll down just a little bit, you'll find a link to click on, and that link will give you the book for free. You can print it for yourself. You can store it in your computer, refer to it. You can read it on your phone. It's a very useful piece of literature, shall I say, a piece of instructional nonfiction that will stand you in good stead and get you through the Medicare process in no time flat. And it's free of charge. That's the beautiful thing about it. Speaking of free of charge, Randy Carson doesn't come free of charge, but he is cheap, I've heard. So good morning, Randy. How are things going for you?
Well, I've always said I'm not free, but I'm reasonable.
Well, all right. That's another way to look at it.
So how are you today, Doug?
Well, I think I'm doing okay. It's a beautiful sunny day in Arizona. How can you complain about that? My pest control guy showed up. I'll tell you, I spent a lot of time in Arizona when I was a kid, and I climbed Camelback Mountain when I was about in third grade, when we were on a chuck wagon, which was like everybody saddled up. There was a
chuck. How do you get up Camelback Mountain with a chuck wagon?
Well, see, the people participating in the meal and drinking portion of the thing, we lived in a dude ranch called the Joe Cocky Inn on Camelback Road, and this is back, that thing was built in the 1920s or 30s, and I was there in the 1950s, and my grandparents would, be participants, active participants in that particular event. I think they did it once a week or maybe twice a week. They would have the wranglers lead everybody through the desert around to the eastern side of Camelback, and then basically it was a drinking time for the adults, and I was the only kid, and I think in a couple of these occasions. What am I going to do? Well, there's that big old mountain right there. Maybe I should climb that. I'll just go part way up. And I kept going, and I kept going, and I kept going, and I kept going, and I was very close, if not right on top of the hump, which is the highest part of Camelback Mountain. Now, in high school, my cousins lived here because my adult cousin, I don't know, once removed or whatever, their father was an employee or the assistant to my grandfather who owned the John Hancock in Phoenix. And so, of course, the two kids one was a year older than me and one was a year younger. And they said, hey, since you're in town and you're our cousin and we know everybody in the family except we don't see you very much, why don't you come with us and we'll climb the head of Camelback Mountain. We did that on a Saturday. I've got some photographs. I was a junior in high school. And boy, that taught me how to use equipment. Now, I'm no expert, and I sure have not done any more of that since then, but we used ropes and carabiners and all kinds of equipment to get up the backside of Camelback Mountain to the head. And up on top of the head, there's a cave that you can goof around in. And if you wanted to, you could light a big fire in there. There's a hole at the top of the head for smoke to escape. It's almost like somebody created it, but there's no evidence of that. And then, of course, we went down back the way we'd come, and it was a lot of fun because it was the first time I'd ever gotten down to rappel. Gotten the opportunity to rappel down cliffs, big cliffs, and some people I've seen on TV find that difficult. I found it to be fun.
Well, you know something? That does sound like fun, because I know, in one of your past lives, you also skydove. You also did some skydiving.
Yep, you and I have that in common.
That sounds like something that, kind of blends into that category.
Yeah.
Did you ever ride motorcycles?
Oh, absolutely.
Okay, yeah, I did too. So the only thing I haven't gotten to do that I really wanted to do, and maybe I still could, but
Does it
I
involve
probably
a Virgin and a...
No, 76 bird. No.
Yeah, okay.
No.
Just checking.
I wanted to learn how to fly a plane.
Yes, I understand that, and I've got a friend, Roy. You've met Roy.
Yeah.
Who used to fly a lot, and he had his own plane, or he owned half a plane with a friend of his. And I've mentioned to him that I wanted to learn how to fly helicopters, and if I had actually gone into the service during the Vietnam War, I would have tried to get into flight school. And Roy said he had a hilarious way of indicating that helicopter flight was not interesting to him at all, because helicopters were not designed to fly. God doesn't want them to fly. So they're all going to crash. It's just a matter of time.
Well, I've heard some people kind of agree with that concept, but I've also heard the interesting thing about learning how to fly a helicopter is that it all of a sudden, the first thing they always teach everybody how to do is hover.
Yes.
And I've heard it said, I've never experienced it, but I used to work with an old Cobra pilot from Vietnam, and he said you're learning, it seems like this incredible thing that you're never going to figure out, how to hover.
Right.
And then he said, all of a sudden, somehow by magic, your brain clicks and it just becomes second nature. Now that's hard to believe, but he said that's the way it works.
And here's the other thing it's hard to believe. I'll bet you that's why they wash so many guys out of flight training, because it doesn't click that way for everybody.
Nothing ever clicked. Nothing ever clicked.
and I've been reading books about what these guys went through. A lot of them came back home and wrote books about their experiences as helicopter pilots. And one of the things that it was interesting was universal in the training, because they trained chopper pilots at 2 or 3 different locations in the U.S., was that the non-coms that were in charge of the trainees had a very specific set of rules about where all of their possessions would be placed in their lockers and their bunks.
Mm-hmm. Yeah.
And they were very, very, very explicit. And if anybody ever violated any one of those things during one of the inspections, all their stuff would be scattered all over the floor. Sometimes it would be scattered all over the floor just out of pure cussedness. And they would have to put everything back in the prescribed order in the prescribed location. And they all thought that was just stupid, but eventually it became apparent that you had to have that kind of a mind that could remember details in certain order in order to not kill yourself in flying helicopters.
Yeah. Well, I mean, obviously, you're using everything. I mean, your right hand is doing one thing, your left hand's doing another, your feet are doing something else, and your brain better be thinking pretty hard, because they're all doing something. Have you ever tried to play snare drum? Okay, snare drums are the same kind of thing. Every part of your body is doing something different.
Yeah, it's I wanted to be a drummer because I thought that would be cool, and I wasn't good at it, so I didn't pursue it. But you're absolutely right, and a helicopter pilot has to be prepared for a lot of eventualities. They don't really duplicate too much in flight school, like guys shooting at you and stuff.
No, they really don't. And, my boss loved this guy to death, still do. I asked him one time, I said, so why did you sit on your flak jacket?
Uh-huh.
He goes, well, it's because they're shooting up at you from underneath. So that's the place you need your flak jacket is underneath. Everybody sat on their flak jacket.
Yeah, they made those things out of really thin aluminum so as not to have to use a lot of fuel, and the horsepower would get them off the ground quickly. But the trade-off for that is bullets. AK-47 rounds would go right through that sheet metal.
Oh yeah. Oh yeah. And I'll tell you one more short story is he called me up one day. We still keep in touch. And he called me up one day. He goes, guess what, Randy? I go, okay, what? Clayton he goes, I was so excited. I got to fly upside down. And I go, okay. So he's a chopper pilot, and he never had an opportunity to fly upside down in a chopper, but he got like a P-38 trainer, that he paid to get to fly, with a assistant in the back.
Yep.
And he got to pilot the thing while he didn't take off or land, but got to pilot the thing in the air. And he got to go upside down, and he was so excited in that because he had never gotten to. I guess you can do it with a helicopter. Probably not a good idea, but he never had.
Well, I would say that it would be a very short ride if you're if you're flying upside down in a helicopter, because the whole point of the main rotor is to fight gravity.
Yes.
And now I did read about these guys that had to come down into very dense jungle, and they called it triple canopy. There were 3 layers of jungle, and they had to keep the tail rotor from hitting anything in addition to keeping the main rotor from hitting anything. And so they would have the 2 door gunner, there was a crew chief and a door gunner, one on one side hanging out the back hole in the helicopter and one on the other side. And these guys would have to tell the pilot, okay, rotate left, rotate right, rotate left, rotate right, to keep the tail shaft from hitting a tree. And they would have to, it was like putting a key into a lock. They had to, as they were dropping down into dense foliage, they had to be very precise. And then they'd either drop off or pick up whoever they were there to, service. And then they'd have to do it in reverse on the way up and out over the canopy.
Yeah, these guys, and most of them, or many of them, I won't say most, but many of them, obviously, they were just, young men, late teens even, some of them.
Yep.
The things they were able to learn and do was freaking amazing, I'm telling you.
Yeah, helicopter pilots were warrant officers for the most part. They created a class of officer that was that was higher than non-commissioned, NCOs, but below commissioned officers. So it was its own class. Now they got to use the officers club as opposed to going to the NCO club, but they were theoretically qualified to be officers, but they weren't commissioned in the same way that regular, like lieutenants and so forth, were.
Yeah. So, are we supposed to make some money today?
Well, I don't know why, because it's, but it's more fun goofing around, but we have responsibilities to our audience. And so I think we should go ahead and perform those responsibilities.
Well, all those bank deposits that we get every week, people paying us for to listen to the Medicare information. We take them gladly, but we need to produce some information.
I hear about those bank deposits. I never actually get to see them. So one of these days, I'd like to be on the receiving end of some of those bank deposits. Medicare Advantage Minute. Ooh, I've got to turn my timer on. 20 minutes. I promise the audience, and you'll have no more and no less than 20 minutes. Well, you might have some more if I get caught in the middle of an article. But 20 minutes on the clock right now. Medicare's 72-hour rule now governs Medicare Advantage approvals. This is the segment, Medicare Advantage Minute, in which I try to warn people that Medicare Advantage has problem areas, and you're going to be better off if you, when you're enrolling in Medicare, enroll in regular Medicare Parts A and B plus a Medicare supplement. Don't fall prey to the Medicare Advantage trap, because you may be trapped if your health takes a nosedive. Medicare's 72-hour decision rule begins now. What seniors must know. about faster approvals and denials. Millions of seniors in Medicare Advantage plans have long dealt with slow responses to requests for medical care, tests, treatments, and so forth and so on. Insurers sometimes took weeks to decide, leaving patients and doctors in limbo. Sure, an insurance company doesn't want to decide quickly how much to spend because there goes the money that they're earning interest on if they don't spend it at all. That's just my editorial right there. New federal requirements from the government and Medicare and Medicaid services now set strict deadlines that apply immediately. The changes focus on prior authorization, the process insurers use to review coverage before services are provided. Under the updated rules, Medicare Advantage plans must decide expedited prior authorization requests within 72 hours. Now, we've touched on this before. That may seem fast to you Medicare Advantage victims, but in reality, 72 hours is something that your average Medicare patient and their doctor don't have to deal with. The doctor and the patient under regular Medicare with a Medicare supplement can make those decisions and implement them immediately without any oversight from Medicare or an insurance company. So this 72-hour timeline applies when a physician determines that a delay could harm the patient's health. Examples include worsening conditions, severe pain, or time-sensitive procedures. Previously, even urgent cases could stretch beyond this window, creating added stress for the patient and the family. This 72-hour rule aims to protect patients who need quick action. I still say 72 hours is not quick enough for me. If I'm in pain or if I've got a deteriorating medical condition, 72 hours is going to seem like forever. So I don't think it may be a big improvement over what's going on right now, but I don't consider that to be ideal. The article goes on to say plans must now treat these requests with clear priority. Doctors determine whether a case qualifies as urgent based on medical judgment. This shift replaces older, more flexible standards that often extended waits. Regular prior authorization requests now face a 7-day deadline instead of the previous 14 days. Well, that's a big improvement. That is a cut of 50%, 7 days instead of 14 days. That doesn't sound that great to me either. This covers many common services such as imaging, specialist visits, surgeries, and equipment. If you need surgery, do you want to wait 7 days for that surgery to be approved? Well, it sounds good if the previous was 14 days and they could stretch it out that long, and now they can only stretch it out for 7 days. But still, that doesn't seem like an ideal situation to me. But I'll go on with the article. The shorter period reduces uncertainty for patients planning care. Insurers must also provide more detailed reasons when they deny a request. Faster denials mean patients learn outcomes sooner, yet they also require quicker follow-up. Clearer explanations can help seniors understand the next steps and prepare appeals if needed. The regulations keep prior authorizations in place, but standardize how quickly the plans must act. The government is encouraging insurance companies to adopt standardized electronic tools for submitting and reviewing requests. Many doctors still rely on faxes and phone calls that slow the process. The new approach seeks to streamline communication between doctors and plans. In practice, this could lower administrative burdens while delivering decisions more reliably. Patients benefit indirectly when systems work smoothly. Providers spend less time chasing paperwork and more time on care. The transition to electronic methods remains ongoing, with plans expected to improve over time. So the timelines under the new rule are urgent requests 72 hours, standard requests 7 days, denial explanations more detailed and specific. So that's theoretically a big improvement over what's going on right now. With decisions arriving faster, seniors need, I apologize, ladies and gentlemen. Seniors need to check mail online portals and provider messages regularly. How about the doctors? I think they can do that stuff too. A denial sent within days can be overlooked if notifications go unread. Missing the window for appeals may affect treatment plans. Advocates recommend confirming with doctors under whether each request was filed as standard or expedited. Appeals remain available when a denial occurs. Physicians can often supply additional information to support the case. The updated rules do not remove prior authorization requirements, so many services will still need advance review. Enrollment in Medicare Advantage continues to grow, placing these changes in front of more beneficiaries, more participants each year. The new deadlines bring both quicker resolutions and the need for prompt patient action. Patients who stay attentive to communication stand to gain the most from their streamlined process. All right. Toni says Toni King is a Medicare advisor who operates out of Katy, Texas, or maybe Houston. She has started sending out little blurbs. I'll just read one of these to you. A lot of people think Medicare gets easier once they gather enough information. And at first, it feels like progress. They save emails, read guides, and compare different pieces of advice. But when it comes time to decide, everything is still scattered. That's where mistakes start to happen, because Medicare isn't just about what you know. It's about whether you can organize what matters before you choose. Without that, decisions come from overload instead of clarity. And decisions made that way usually are the ones people regret later. Before you move forward, take a step back and make sure you're not trying to decide without a clear way to sort what matters. Learn more about the Toni Says Medicare Roadmap by clicking on the button below. Okay, this is disgusting to me. This is written obviously by AI. I know Toni did not write it. She spells her name with an I, by the way, because she's not a guy. But I will tell you that this AI flowery piece of garbage is one of the kinds of stupid things that still convinces people and scares people into thinking that Medicare is a thing to be feared and a thing that people need to make a million decisions about. Medicare can be very, very simple. This is why at the beginning of my book, Medicare for the Lazy Man, you find just a few short pages of the exact recommendations that I make. And they're very clear, very straightforward. And if you follow those recommendations, you will always have the maximum freedom of choice that the Medicare program provides. And I'll tell you right now, that same outlook is available in Medicare Enrollment Guide. Medicare Enrollment Guide just has a little more detail about how to exercise the process of enrolling in Medicare once you follow my recommendations. But my recommendations are designed to give the maximum freedom, the finest protection, medical insurance protection, with the minimum available cost. And that's what I do for you. And so I just thought it'd be fun to read another one of these little blurbs. She sends these out regularly. Hello, Doug. One woman thought she was ready to choose her Medicare plan. She had read enough to feel confident and believed that she was close to making the right decision. But when she slowed down and looked more carefully, something changed. She realized she was about to choose a plan based on what sounded good, not on what actually fit her situation. The difference would have cost her money after enrollment. This is what many people miss. A little knowledge can create confidence too early, and that's when mistakes happen. If you'd rather catch the mistakes before it costs you, then your next step is to buy Toni's thing that she's flogging here, the Toni Says Medicare Roadmap. I got to tell you, she is contributing to the confusion, the fear, and the angst that people feel when they approach Medicare. It's simple. It's a series of very, very simple decisions. And in everything I write, I try to lay out each of those decisions and the consequences for making a decision one way versus the other, the potential consequences and the very real consequences, so that you will have a very clear roadmap. So Toni often helps people, and I often applaud her for doing that. But this time, she's not doing anything to make people feel confident about Medicare. We've got a buddy down in Texas named Steve, and he contacts me periodically. And one of the questions that he asked me recently was, how can they, which is the government, there's a talk in the government about forcing new Medicare participants to take a Medicare Advantage plan if they don't choose something else like a Medicare supplement when they first enroll in Medicare. And Steve's question is, how can they default someone to Medicare Advantage when there are so many policies available? And I will answer Steve by saying that if you go to the Medicare books that the government puts out every year in various locations or for various states, you'll find that they list all of the Medicare Advantage plans that are available in that state. Some of them are available in every location in the state, and others are available only in certain zip codes. But that's how they would do it. They would say, all right, you live in, let's say, Chattanooga. Here are all the Medicare Advantage plans that are available in Chattanooga. Pick one. And if there are 5 Medicare Advantage plans and you're supposed to throw a dart and pick one, my question would be, how do you know that it's going to be the one that really is going to be helpful to you? Well, it doesn't matter in their minds because you have the opportunity to change every year. So when AEP or annual open enrollment comes around in October, you can pick out a different plan to start January 1st. In the meantime, you've been forced into the world of Medicare Advantage. You have been robbed of the opportunity to enjoy a Medicare supplement plan with Original Medicare, which offers you the freedom of choice of seeing any doctor in the United States that accepts Medicare, which is, I've heard, up to 98% of all doctors. So this is a very bad idea. It's being promoted by a Republican who's running for the Senate, I think, in Arizona, or governor. I think he's running for governor. And I'm not at all impressed with that particular idea that he has. And he would probably say, well, it's going to save a lot of money, but that's not true either. We know, Randy and I have heard repeatedly that Medicare Advantage companies manage to milk the system for more of your tax dollars than Medicare ever did. So Steve also did make a very kind comment, and I'd like to mention this too. He said, I get the impression that and then I guess he got distracted because he probably had to get up and go answer the door, and then he came back and said, is having a hard time with her vision. I'm sorry that you all are going through all that. And I think he meant the content curator. Yes, she is suffering with a lot of eye surgeries and glaucoma and macular degeneration, and her vision right now is not what it should be and not what it was up until last Christmas. So I'm hoping that that situation will resolve itself. In the meantime, I said to, here's the website where people can go to get a list of all the plans in their area if they plug in their zip code. It's www.medigap-supplemental-insurance-plans. Those are just the Medicare supplement plans that are available in your area. So if this were to come to pass, that the government forces people into Medicare Advantage when they first enroll in Medicare, and you say, I'm not going to do that, what you should do is get a hold of me. Go to MedicareForTheLazyMan.com and click on send me a quote and fill out the short little questionnaire, and then we can communicate that way. That's better than going to the government website to look up the available plans in your area. And let's do a little bit of correspondence from a current client, shall we? This is a gentleman that I'm going to be talking to about some real estate after the episode ends. His name is John, and he says, Hi, Doug, a couple of items. Application, Section F, line 7A. He says, I haven't turned 65 yet. Well, on that form, it's a questionnaire, and I have to tell people it's just a method of you talking to me and me talking to you. It's not really an official application. It's just a questionnaire. And it says, at what age are you enrolling in Medicare? And in this case, he was enrolling on the first of the month that he was eligible, but his 65th birthday came in the middle of the month. So he says, he's taking it very literally. And the answer to that is, don't take it so literally. You're having your 65th birthday in the middle of the month. makes you officially eligible for Medicare starting on the first of that month, because Medicare always starts on the first of a month. So if you're going to turn 65 in June, or let's say July of this year, let's say your 65th birthday is in the middle of July, you are eligible for Medicare on July 1st, even though you won't be officially 65 for another couple of weeks. Now, let's say that your birthday is on August 1st. Well, that means you get to move a whole month earlier. And even though you were born in August, on August 1st, your eligible date is July 1st. So if you're born on the first of a month, you're eligible for Medicare if you want to exercise that eligibility on the first of the prior month. But since most people aren't born on the first of a month, they're born on a different day. The first day of the month in which your birthday falls is going to be your Medicare eligibility date. Then he asked another question: payment method. Is it credit card an option without additional fees? Well, the first payment, almost every Medicare supplement company demands that the first payment be a draft from your checking account or a check that you mail in. Now, when I do your application online, obviously I can't shove a check from you into the computer. So I say, no, the first premium, the initial premium, has to be a draft from your checking account. And I understand a lot of people don't like to put their checking account information out there, but in this case, I do it on a secure portal in the insurance company's computers. So it's not risky from a security standpoint unless the computer or the insurance company is screwed up. But the way the first premium is handled is different from the way all other premiums are handled. If we're doing the application early, let's say your birthday is in July, so your effective date, your Medicare eligibility date is July 1st, and let's say I'm doing your enrollment application for Medicare on June 4th. So what happens is the underwriters will get their grubby mitts on your application, and they will review it, and they will say, all right, this person meets all the criteria for enrollment in Medicare on July 1st. Today is June 4th. We will then approve this application today, and we will draw the first monthly premium from his checking account today, even though it's not even July yet. And so that is the way that they seal the deal. The three elements of a contract are being met. There's the offer. I have offered to have the person apply for Medicare supplement. There is the acceptance. The person has done the application and the company has accepted the application for coverage, and the exchange of valuable what is that term? There's a term there.
Consideration.
Thank you so much, sir. I'm going to have a greater respect for your understanding of contract law in the future. But the consideration, the valuable consideration then, is drawn from the checking account no matter how far in advance. And I've got people that have enrolled in Medicare supplements 3 months ahead of their actual eligibility date, and they come back to me and they say, hey, how come this company is stealing money from my account? And are they going to do that every month so they'll always be 3 months ahead? And I say, nope, because premium number 2 for the second month will be drawn on the day that you tell them you want it to be drawn. So there's a little place there where they say, what date of the month would you like your next premium and all your subsequent premiums to be drawn? And you can pick anything between the first day of the month and the 28th day of the month, because every month has at least 28 days. So after that first monthly premium, which could fall anytime, it's always on the day that they approve the application, your second and subsequent premiums will fall on a day of the month or very close to it that day that you have told the insurance company you want your payment to be made. And then I also, John had another question here. The age 65 autofilled. Let's see, what was his question? Okay. His question about, I haven't turned 65 yet. And I said the age 65 blank autofilled because you will be 65 in April when your Medicare coverage begins. This rather than being under age 65 and getting Medicare due to disability. As for the payment, my online form does not offer credit card payment as an option for the initial premium payment, as you can see in the photo below. So I took photographs of the computer screen. The thing to do is to follow these instructions to change your payment method for the second and subsequent premiums. Many companies offer a little more flexibility after that first premium payment. So the first premium has to be drawn from your account, and it could be drawn whatever day the insurance company approves your application. And after that, the second and subsequent premiums can be drawn from your checking account, which is what most people do. But if you want to change your method of payment to credit card or billing or any number of other types of options, payment options, those can be done with some companies. Each company has its own criteria, and each company will allow some or no flexibility. But they all have the draft from the checking account. And the 20-minute timer has let me know that I have exceeded my allotted time here, Randy, and I think I'm pretty much finished for today.
So I'm going to pull up our tent stakes and go then. But before we do, I've always got some really important stuff to talk to you about, and it requires that you grab a pencil. Number 2, as a matter of fact.
Ooh.
Number 3 doesn't work. So write down this email address. It may be the most valuable email address that you have in your possession. dbj@mlmmailbag.com. That email address is connected to Doug. He monitors it 24/7 to answer your questions and make comments too. Every state in the union, Doug is licensed to help you with your Medicare supplement planning. Not DBJ. That's his email address. That's not your website.
I got Medicare a lot of email addresses.
I tried to memorize them once and I gave up.
Yeah,
MedicareForTheLazyMan.com. That's the website. I think there's some cool stuff going on there, if I do say so myself. In your wanderings through the internet, drop some reviews on Doug's work. It's important because we want to stay ahead of the travelogue people in the polls, and that's really important. And we try to do that every year, and so far we have. And thank you for joining us. You could have been anywhere else, doing anything else, and you weren't. You were with us, listening to the Medicare for the Lazy Man podcast with Doug Jones. And just in case you didn't know, you have spent about 32 and a half minutes with Doug Jones, originally living in Oklahoma. Now he has moved to Arizona, living in the high ground behind Cave Creek, Arizona, in the Nosebleed Mountains, home of the Nosebleed Indians. And I would also like to say I check every day, every recording day to see how high he is. And I'm going to put him in easily at 3,200 feet today.
Remember how I used to be so high that when you would ask me how high I was, I couldn't even answer? Those were the days, weren't they? Those were.
I know. That's exactly what I'm trying to get you to again.
Well, 3,200 feet is a good start, but thank you so much, ladies and gentlemen, for joining us. I hope you're not as high as I often am, but in any event, we will look forward to having you join us for our next recording session, which will come up any day now. So get ready for that invitation and join us for the next episode of the Medicare for the Lazy Man podcast. Until then, bye-bye.